We shouldn't take for granted anyone who says they're having suicidal thoughts, those type of things. We don't want to make assumptions based on what maybe has been portrayed in popular culture about people who are suicidal.
I've been in suicide prevention for almost 7 years now. There are a lot of veterans that are not using the VA system, so we want to make sure that all the interventions that they're getting in suicide prevention are available to folks that are not utilizing those services. They may be getting their care elsewhere for whatever reason. Today we were invited by Veterans Club to come out and provide S.A.V.E. training, which is the VA produced gatekeeper training for suicide prevention. And it's basically to teach anyone in the community who might interact with a veteran, work with a veteran, live with a veteran, to have conversations about potential mental health crisis and suicide.
It's important to talk about suicide prevention with veterans and first responders because of the great deal of trauma that they experience on a day-to-day or in their past, sometimes hardships that they're uncomfortable talking about. So it's very important to recognize signs and be able to talk them through it and get them help. What brought me here is my own experience with trauma and suicidal thoughts, but also I want to start a combat recovery center for veterans that suffer from PTSD from their combat experience. Marrying a veteran and living the experience of his trauma and the issues that were caused by him being a veteran has motivated me to help more and more people. The need is even greater than I realized.
Right now, in the most recent VA study, it was about 53% more represented than the general population in suicide rates. What we want to provide folks is encouragement to feel like they are confident in being able to intervene with someone. A lot of folks may not necessarily feel like it's their place to intervene, but the reality of it is that if you are just willing to listen and willing to validate that person's feelings and be a conduit to whatever care or treatment or strategies that they might need, then that's a really valuable way to prevent suicide.
You don't always see the signs if you don't know what the signs are. There's a lot of signs that one wouldn't even think about. So going through the training will help you. I think it's important for really everybody.
Anything that you do to try to make them feel like they are loved and cared for will really be a lifeline to them.